Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. I am a white woman with medium length blonde hair sitting in front of a podcast microphone, and my Zoom background is blurred. And I'm here today with Dr. Stephanie Van, who's a Johns Hopkins rehabilitation physician specializing in interventional pain management. She's also the founder of YouTube's This Ability Clinic, which is a disability conscious healthcare education platform that's accessible and entertaining for everybody. Dr. Van, thank you so much for being here.
Thank you so much for having me. It's an honor to be here. I'm Dr. Stephanie Van. I'm going to sign in ASL. My name is Dr. Van. I'm a Vietnamese woman with long dark hair, wearing a navy Hopkins blazer and a black blouse, sitting in front of a colorful bookshelf that reflects my medical background, my passion for culture and media, and my passion for disability advocacy.
Excellent. Thank you so much. So, we're going to start out by talking about how your work as a pain management specialist sort of overlaps with your work as a disability advocate and how you view and treat disability.
Absolutely. I think pain medicine is such an important field. Even though it's a specialty, it serves such a variety and diversity of people. So, no matter what someone has been through medically, surgically, whatnot, pain is usually a very impactful issue, interfering with their quality of life. So, I love being able to present people with a bunch of different options, no matter what they've been through, to kind of help them with their goals. I feel like pain is a universal disabler in that way. So even though I'm quite early in my career, I graduated my fellowship in 2020. I've seen such a diversity of people, and it's wonderful to feel like I can serve and be useful to anybody, really. And that includes people with disabilities. And that's been the overwhelming amount of people who I feel need help the most. And healthcare doesn't have the best understanding yet of really how to serve this diverse population.
When you're talking about pain as sort of the universal disabler, I know a lot of the patients that you work with are dealing with newly acquired disabilities, things that they haven't had to deal with before. So, what do you think is important for everybody to understand about disability, with the context of any one of us could be faced with this?
Yeah, absolutely. I think an important thing to understand or keep in mind, even if you haven't experienced disability before, is that unfortunately, it's eventually inevitable. Like, I think it's one of the human experiences that we will all get to experience eventually. And then another thing is that just kind of meeting someone or just looking at someone, you really have no idea what they've been through, what they're bringing to the table. It's really important not to make any assumptions. I feel like making assumptions, making judgments, that's at the root of misunderstanding someone who might seem very different from you, and it might prevent you from realizing how much you might have in common with that person and how much you might be able to collaborate.
So let's talk a little bit about like, some specific scenarios that you've seen. So, for some people, obviously who've been watching and following your channel, this world is nothing new to them. But for a lot of our listeners, they may not associate pain with disability. Can you talk a little bit about some of the specifics of your work there?
Yeah, absolutely. I would say that pain happens from any bodily structure, being injured or affected by disease. And many people who come to my clinic, they're not used to having limitations. And so when we talk about people acquiring disability, like becoming disabled, it's a big adjustment for anybody who's used to basically not having to worry about that. And so I think a lot of what I do is I help people first understand what's happening with their body, whether that's like, oh, a straightforward like sports injury that's going to heal and usually people do fine versus a much more complicated injury that's affecting multiple systems in the body. It's really just a matter of helping people wrap their heads around, okay, what's this new baseline? What's this new situation that I'm in? Because even if there's not miracle treatments or things to easily reverse what's ailing someone, if they can understand what's happening to them, it gives them back some sense of control and ownership of like, okay, this is still my body, this is still my life, and I can move forward.
And so your work as a pain management specialist has really sort of, opened up this world of disability education for you. And as a practitioner, obviously people with disabilities come into contact with all kinds of practitioners, not just pain management specialists. So, what needs to change, or what kind of things have you seen in the healthcare field? And also, in terms of the industry that can be more inclusive and better support people with disabilities when they come into the doctor's office?
That's an important question on so many levels. I feel like the work that I've been able to be most impactful on is just that one-on-one patient-provider dynamic where providers can really use specific types of language or jargon to help someone understand what's going on with them and help support them with making decisions about their care. So one of my core teaching points in any talk or conversation I have with a provider is think about the language that we're using. Like, are we using outdated biased terminology that kind of perpetuates prejudice, or can we choose words that are more inclusive, still helpful, still accurate, but don't have that same sense of baggage and stigma? An example I like to use is wheelchair bound is such a common phrase, unfortunately, in healthcare. And so I always, whenever I hear that at conferences, talks, I say, actually, the preferred term is wheelchair user. And I love the language change because it's such a simple word choice, but it can really shift the mindset of how someone thinks about disability, and it can kind of spread throughout different communities, different healthcare settings. Another one of my big tips is to really center the patient that we're serving as the leader of the healthcare team. I think traditionally it's thought of as, oh, the physician is the most knowledgeable. They should be making the decision and driving the changes. But really, I think of providers as, working for our patients. Like, we're the ones there to serve. We're the ones laying out the options and helping to assist the patient with their decision making. So I think that simple change in mindset can help an individual provider just practice more inclusion and accessibility in their practice. Now, healthcare as a wider institution, obviously there's different levels. There's hospitals, clinics, and then the greater culture in general. There's a lot of work that still needs to be done in terms of physical accessibility, even like facilities being ADA compliant, and then cultural accessibility, streamlining communication between specialists. Like you're saying, people who have a lot of complicated issues, they might be seeing 5, 6, 7 different specialists, and they all might be very well versed in their fields. But if they're not communicating, it's extra work, extra burden on the patient to coordinate that care, when really the system should be better designed to facilitate that. And then don't get me started about insurance coverage and costs of healthcare. That's a whole other
That's a
episode.
whole other podcast. Yeah, that's a
Yeah.
whole other actually like podcast, entity really. And by the way, throughout our conversation, if I say anything that is not aligned with what you know to be like the better term, please feel free to correct me right here on the spot. This is how we learn. This is how our listeners can learn. So I just wanted to put that in there.
I really
Um,
appreciate that. And that's another sort of important staple of like, how is this change going to happen? It's we have to think about our own accountability, just being open to like, okay, I know I'm not going to do this perfectly. I may not always say the right thing, but let me know how I can be better. Like, that attitude is what's going to help the whole industry be more successful and being more accessible.
so let's talk a little bit about, because you'd mentioned representation, and I want to take a step back and think about, a number of your videos look at injury and disability as it's represented in popular culture, TV shows, movies. Do you see the media landscape shifting towards more meaningful and accurate representations of disability, and how, because that, like you said, that's how we all learn, is to see people that are in these situations and to know them as human beings?
Absolutely. I want to give the media, culture, Hollywood some credit because I do think there's been a good momentum shift in the right direction. More disabled actors and content creators are being highlighted and featured in more mainstream features, which is very exciting. There's still a lot of work to be done. A common statistic that's quoted is 25% of the population identifies as disabled, but then only 2% of disability is what's represented on screen. So I think the more we support this type of authentic representation, the more it's going to happen and snowball, especially with sort of the explosion of social media and just everybody getting on the internet more than ever with the pandemic and going virtual. I think that's really opened up a lot of people to this world of accessibility and being like, huh, like, how do we make this content more accessible to people who with hearing disabilities or visual disabilities? And how can we make this content reach as wide of an audience as possible? So I think that's a really exciting um, notion that, you know, big media companies are finally tapping into.
Yeah, I've seen a lot lately, in shows where they're casting people and it's not like the friend with the disability. It's just the friend that happens to have a disability and it's not a part of the major plot line. It's just, who they are, and I appreciate seeing that. Is that an example of what you're talking about?
Absolutely. I think that's a huge feeling within the disabled community that they obviously they are loud and proud about having identifying with disabilities, but at the same time, they are so much more than that. You know, they're just people, just like everybody else. And so I feel like when the focus is solely on disability, that's when the characters don't seem authentic. They seem one dimensional. Whereas having a disability as just being another facet of a whole character, that's a much more authentic representation that makes a character even more relatable because you can see their multiple layers and find something in there that resonates with you.
So we've talked about language. We've talked about thinking about accessibility first. We've talked about seeing people holistically. July is Disability Pride Month. And what are some things that everybody can do to think about people with disabilities in their everyday lives beyond what we've already talked about?
I One of the best, easiest ways I find to kind of dip your toe in the movement, especially I have to always remind myself, like, everybody is new to this at some point. Like, I was new to this. There are people out there who don't even realize that ableism or disability advocacy is a thing. But with the momentum behind social change and the movements against racism, classism, sexism, gender biases, like these are all very well aligned. So I feel like an easy way to get a taste for the movement is to follow some disability hashtags, hashtag disability, hashtag accessibility, or hashtag disability visibility. If you're scrolling through, you know, choose your social media platform. Mine is Instagram. There are so many great content creators out there who identify as disabled, who showcase what their lives are like. And I feel like that's the best way is learning from the community. That's the source. They're living it. And that's really, in my mind, the only way to really get a sense for, you know, what needs to happen in this movement and how can we get more people to join. There are a lot of great resources out there too. One of my favorite books that I recommend to people, either audio or just, you know, reading a hard copy, is called It's Demystifying Disability by Emily Ladau. I had the honor of interviewing her on my YouTube channel last year, and she also was featured in a webinar hosted by Hopkins during last year's Disability Pride Month event. I think her book is just a really accessible, quick, easy listen or read, and it really helps ground anyone, like in any stage of advocacy, to what the disability movement is about. And we already talked a little bit about this, but kind of like what I was saying about highlighting disabled creators and consuming their content, bringing disabled people in your community, like your students, your trainees, your faculty, and staff, especially in academia and medicine. I feel like that's the best way to answer those questions of what do we need to do to be more accessible? How can we be more inclusive? It's okay to not have those answers, but you know that you're going to get some of those answers from people who are living with disabilities. So I can't emphasize that enough as like, if you're wondering where to start, ask someone who has a disability and they will point you in the right direction.
Excellent. Well, thank you so much. We're going to include some of those hashtags for sure in the show notes, and we will also include a link to your YouTube channel where people can learn more. But thank you so much, Stephanie, for being with us today. This is a really important conversation, and we're hoping to touch base with you again in the future.
Thank you so much for watching, listening, and learning.